Now to an important health conversation about liver cancer. As of this year, the leading cause of cancer death in patients younger than 50 years old is colon and rectal cancer. What do we need to know given this unsettling finding? Well, let's go ahead and ask Moffitt Cancer Center's Dr. Betzaira Childers. Welcome, doctor. How are you?
Thank you. I'm doing very well. Thank you for having me.
Yeah, I mean, I feel like you hear it in the headlines. Let's go ahead and start this conversation. Why is liver cancer, though, not talked about as much as some of these other cancers that we do hear about?
Sure. So liver cancer is kind of an umbrella term that refers to both tumors that start in the liver and also tumors that can go to the liver. So sometimes I think there can be a little bit of confusion of what all that involves.
Yeah.
But as you mentioned, it's particularly prevalent because we know as of 2026 that the leading cause of death in patients under 50 years old is colon and rectal cancer that can go to the liver. And so I do think this is a particularly important topic that patients should be aware of.
Well, it seems like, you think of colonoscopies to detect colon cancer. Sure. What about early detection? Is that one of the things that we strive for? And how are you able to early diagnose liver cancers?
Sure. So for colonoscopies, as you mentioned, those the age for patients to be screened is now 45 years old. So it is younger. So that is one of the ways that we try to identify this early. The reason liver cancer is hard to diagnose in general is because most patients won't have symptoms unless they have a tumor that is in a location that is affecting the function of their liver, like their bile drainage, or is big enough to have symptoms. And so symptoms like abdominal pain, weight loss that's unexpected, yellowing of the eyes or the skin, those are symptoms that should definitely not be ignored, and patients should seek evaluation for that.
Well, and like you bring up patients 45 years old and up, or different, warning signs. Are there anything that people can look for or maybe be aware of and be more cautious of as a result?
So things that puts patients at risk for liver cancer in general is, one, if patients have a history of heavy alcohol use or have a formal diagnosis of cirrhosis, puts them at increased risk for developing cancers.
Okay.
In addition, if they have a history of hepatitis, again, they can have increased risk for tumors in the liver. And then secondly, if they have a history of colon or rectal cancer, they are at risk for developing metastases to the liver. So something to be aware of when they think about their individual risk.
Well, let's talk treatment options.
Sure.
You get the diagnosis. Where do you go? What's next? What are some of the findings and new research that's excited when it does come to treatment for you?
So treatment of liver cancer is definitely not a one-size-fits-all.
Yeah.
The patient-specific characteristics, their specific cancer diagnosis, where the tumors are within their liver, their fitness as a patient. All of these things are, things we take into consideration when arriving at a treatment plan for each patient that is going to work for them. Treatment options include surgery that could be open or robotic. We offer both at Moffitt. Ablation, radiation, systemic therapies, immunotherapy, and most recently, histotripsy has become a new modality that is available at Moffitt for our patients. And what that involves is no cut, no incision, ultrasound that mechanically breaks down the tumors.
Oh, wow.
And that's a treatment that's specific to the liver.
I'm assuming that would be less invasive as well.
Yeah, so that's one of the beauties of it is that patients do require general anesthesia for it.
Yeah.
But no cuts, no incisions. And the patients who are candidates for this are, as I mentioned, have a diagnosis of liver tumor or liver cancer of some sort. But secondly, the other important aspect of this is undergoing evaluation to make sure that it's the right treatment, because we know that we have data to support our current recommendations. So usually if patients are not a candidate for trusted, tried, and trialed treatments, then this is when we start considering histotripsy, but that is available as well.
Well, I got to tell you again, with this latest study and how it has become prevalent, I'm so glad we were able to put the spotlight on it today. Thank you for the great work you're doing, Dr. Childers.
Absolutely, it's a pleasure.
There's the information. If you want to learn more about what Moffitt Cancer Center can do, how they can help you, there's the contact information.